Welcome. I'm Diana Braun, founder of the Knee Zone. I am joined today by Dr. Raj Sinha, my husband. How long does stiffness last? I am 10 days post-op and having a problem with movement. So if you are here, we may have a few other questions, but I think Raj and I are both going to answer this question. I'm going to answer it from the patient perspective because I had both my knees replaced. I can remember what that feels like, how annoying it felt. So I'm going to answer it from the patient perspective, and then Raj, Dr. Sinha, is going to answer it from the orthopedic surgeon expert view. So from the patient perspective, yeah, 10 days post-op is not a fun place to be, and my heart goes out to you. Those first 2 weeks can be really challenging. It's also a bit of a mental game. So I want to honor you with that could feel like what you said, you're having a problem with movement. When you say you're having a problem with movement, some of it is, and again, we're going to ask more questions, and if you were here, it'd be great. But that idea with movement sometimes is you still have a lot of swelling and that causes stiffness. And so you're at this early phase where your really most important job is, if your surgeon's giving you pain medication, you need to stay on that schedule, because if you start chasing the pain, which I know you'll talk about, it makes that stiffness even more uncomfortable. Another thing too is with movement is actually you really need to be focusing on keeping your leg really straight and elevated right now to get the swelling to come down so you can actually move more, which I know is super counterintuitive at times. But once I broke that in my brain, thanks to your help, it really allowed me to move more. But I will forewarn you, you are 10 months in to a many month journey, and we'll talk about that as we go today. But just think about, just for a second, how far you've come in the last 10 days, and really think about one thing that has improved, because that's really going to help you hold on to the fact that you are improving. And a lot of it is our optics about, well, I'm 10 days, I should be done. And it's kind of hard because everybody's knee replacement recovery is their own. Some people recover faster than others. That doesn't mean you're falling behind, but sometimes we are guilty of having really false impressions of where you should be at this point. And that's why we wrote our book, Knee Replacement Secrets. It's why we give out a free timeline with a little video of explaining what you should expect, especially those first 2 weeks, which is right where you are right now.
So stiffness and movement may or may not be necessarily the same thing. So let's talk about stiffness first, and we'll talk about motion second. So stiffness is multifactorial. Number one, you've had a major operation. As Diana mentioned, there's going to be a significant amount of swelling in the knee that's going to cause the knee to feel tight and stiff. Elevation and ice are your two best friends for that. The second thing is that the operation itself is a little bit on the brutal side. and that's what causes some of the pain and the swelling. But then on top of that, we're putting in metal and plastic pieces into your knee. Your body was not designed for that. So in addition to recovering from this somewhat brutal operation, you're not going through this biological process of adapting to having foreign objects inside your body. So that's going to cause some stiffness. That's going to cause some warmth. That can cause this sensation of tightness. Sometimes people feel like they have a band around their upper knee or lower quad, lower thigh is what people describe to me. And I think that's all very common. Now, motion/movement in the early phases, extension, getting the knee fully straight is your most important job. There's been tons of research done that shows that people who have full extension actually get flexion faster, and secondarily, their overall function is better the quicker they get full extension. So in those early days, really focus on extension. The mistake that I see people make commonly is they sit on a recliner, and the recliner elevates the lower leg, and that automatically flexes your knee. And you think you have a straight leg and you're elevating, but you're only getting part of the thing correct. You're getting the elevation correct, but you're not getting the leg straight. And so you need to do both early on. Now, in terms of flexion, degree of flexion, so I've been doing this for a long time.
Which is bending for those
Yes,
of
I'm
us
sorry.
who don't use fancy words.
Bending, the amount of bending you have, or flexion. So I've been doing this for a long time, way back 40 years ago, when I first started in orthopedics, our goal was to get 90 degrees of flexion by 6 weeks. 6 weeks, not 10 days, 42 days. If you got 90 degrees, you were doing really well. Now, because of a lot of pain management strategies that we've done with nerve blocks and rapid recovery protocols and things like that, people get bending faster. No, there's no doubt about it. But still, if you're at 15 or 20 degrees at a week or two, I'm not too worried about that. I don't start to get worried until you can't get 90 degrees by 4 or 6 weeks in today's modern protocol. So I wouldn't focus and worry about the bending so much. I would focus on pain control, as Diana mentioned, stay ahead of the pain. All of the medications that we prescribe for you really, let me back up. Stay ahead of the pain means multimodal approach, multiple different medications. So Tylenol, for example, people say, "Oh, Tylenol doesn't do anything for me," but if you take it on schedule, it plays a role. An anti-inflammatory medication, if you can take it, plays a role. And actually, an anti-inflammatory actually helps to decrease the swelling. So anti-inflammatories are things like ibuprofen, naproxen, those sorts of medications. And then when you get into the narcotics, there's this real emphasis to get away from narcotics, but there's a role early on in using narcotic medications because, again, there's tons of research that shows that if you control the pain early on, your recovery goes better, and you actually wind up using less medication. So if you need the narcotics early on, take them. Now there's some side effects related to that, and you got to kind of balance all of that out. But remember, the narcotics really make your brain not care about the pain. It doesn't treat the pain. It doesn't block the cause of the pain. It just makes your brain not care about it. So there's a role there, but the goal is to get off of it as soon as you can. I think we hit all those
Yeah, and
topics.
Cindy, I'm going to reiterate, straightening your leg the right way is so important, and not to push bending too soon. There's a lot of people that really get focused on trying to bend their leg before they have that full straightening, and it can cause a lot of stiffness. So, all right, y'all, thanks for joining us today, and we'll be again soon. Thanks.